How to conduct a mental capacity assessment by Medical ICT Solutions. Hello and welcome to our channel. Today, we will be discussing how to conduct a mental capacity assessment. We will define capacity, the underlying principles of Mental Capacity Act 2005, and the criteria for adult capacity under the Mental Capacity Act 2005. We will also provide an example of a confused elderly woman who requires an invasive medical procedure. Firstly, let's define capacity. Capacity refers to a person's ability to make decisions for themselves. It involves the ability to understand and weigh information, communicate decisions, and appreciate the consequences of those decisions. The Mental Capacity Act 2005 is a law in England and Wales that sets out the framework for assessing capacity. It is based on 5 underlying principles, which are 1. Presumption of capacity. 2. Maximising a person's ability to make decisions. 3. Unwise decisions do not equal incapacity. 4. Best interests decision-making. 5. Least restrictive option. Now, let's look at the criteria for adult capacity under the Mental Capacity Act 2005. To have capacity, a person must be able to 1. Understand the information given to them. 2. Retain that information long enough to make a decision. 3. Weigh up the information available to them. 4. Communicate their decision. To give you an idea of how a mental capacity assessment works in practice, let's consider the case of a confused elderly woman who required an invasive medical procedure. In this example, to be able to determine capacity effectively, a candidate will need to employ appropriate communication skills to explore whether the patient is able to meet the criteria of capacity as mentioned above. You will need to determine the patient's comprehension of information, the patient's ability to retain that information, whether the patient can weigh information in the balance to reach a considered decision, and communicate the decision. You should begin with an appropriate introduction telling the patient your full name and role and checking the patient's identity and preferred form of address. You should invite the patient to tell you why he is attending and what he expects to happen at the consultation. Allowing the patient time to share his expectations and understanding of the procedure will enable you to offer appropriately relevant information at the right level of detail. Assessing comprehension, you should offer the patient information in simple terms, explaining the benefits of the procedure. As well as describing the purpose of the procedure, you should offer some guidance on possible disadvantages, e.g., that sometimes the symptoms may worsen before it improves, and it is not always successful in managing the problems. Checking retention. You should explicitly demonstrate that you are checking the patient's understanding and retention by asking, for example, I realize that I've given you a lot of information. What do you understand so far? And, is there anything you would like explained further? Exploring whether information is being weighed in the balance. A simple way to explore this aspect of capacity assessment is to ask, how do you feel about the procedure now we've discussed it a bit? Or, now you've heard more about the procedure. What are your thoughts about the procedure? Communication of decision. This is a step that is often overlooked in capacity assessments. Having explored whether a patient is capacitous to make a decision, don't forget to give the patient the opportunity to communicate whether he has actually reached a decision. It is also good practice to summarize the consultation, invite further questions from the patient, and explain that you will share your discussion with the patient with your consultant. Throughout the consultation, you should verify understanding, check pace, be alert to non-verbal communication, and invite the patient to ask questions. A systematic and organized approach should be the aim throughout. That's it for our guide on how to conduct a mental capacity assessment. We hope this video has been informative and helpful. If you have any questions or comments, please leave them in the comments section below. Don't forget to like and subscribe to our channel for more informative content. Thank you for watching.